We would like to welcome Chairman Merle Smith to our 2020 Virtual Telehealth Summit for South Carolina. With the pandemic hitting us and turning our world upside down, one of the bright positives I think that came out of it was the explosion of telehealth. Would you comment on that and tell us kind of what you think telehealth in South Carolina looks like today? You can talk briefly about all of your efforts with the South Carolina Telehealth Alliance. You were very instrumental in getting that going and finding the funding, and then kind of what you think the future is.
Yeah, absolutely. And you know, I hate that pandemic and a global tragedy causes us to recognize the importance of telehealth in not only in South Carolina but throughout the country. But you know, I would say first and foremost is those of us who've been involved in this for years. This is something that we've been working on for over a decade now, I would say. And so this is not something that's new to us who have been in the industry, and really not new to patients across South Carolina. Telehealth's been used in a variety of areas, as you know, telestroke, tele-ICU, doing telehealth within schools and mental health, telepsychiatry. But this is the first time where the vast majority of citizens of the state learned that there's an acceptable alternative in having a face-to-face encounter with your provider in this, and that is being able to do it via telehealth. So out of some good, out of some bad comes some good, and that's what I think we've had here. And it's very fortunate for us because, as you know, and your members and people who are interested in this, is that we've had struggles over the years with reimbursement and whether telehealth was an appropriate means of treatment or care or preventive care. And we've had some issues that we've had to deal with legislatively and still struggle with reimbursements and it being an acceptable form of treatment or care to a patient. And so what we saw as a result of this global pandemic is that telehealth got accelerated to the front. And as you know, I mean, before when we first started having COVID testing, you had to go and you had to have a visit with a physician before they would pay for it. And those were encouraged to be a telehealth visit. And so, I think that's one thing that we've seen with this is now that people are becoming acclimated to telehealth as an acceptable option, and they're probably using it more than they are the face-to-face if they can utilize that. And so it's really set us forward on accelerating this as an acceptable use, making it a reimbursable visit. And I think the federal government and the state of South Carolina have made great strides in making sure that telehealth is an acceptable option to the citizens of the state.
Well, I totally agree with you on that. And you've mentioned reimbursement a few times. And not only, I think, did CMS and Medicaid really step up to the plate to further expansion of broadband with better reimbursement, but so did our private payers. Right. So I think it's going to be incumbent upon us to make sure that reimbursement stays post-COVID-19. Any thoughts on that?
Well, I think that's the most important thing is what we don't need to do is things that we have acclimated ourselves to now that are acceptable means. I mean, not only telehealth, I mean, think of numerous having these Zoom meetings now. I'm a lawyer and we are having virtual hearings now, not driving all over the state and having to argue motions or having status conferences with judge. We're doing it all from our desk. So what we need to do is take this advancement and this new way that we're working and exercising our lives through virtually and make sure that stays there. And one of the most important things is going to be reimbursements, because reimbursements don't need to go backwards, and they don't need to all of a sudden shut off the spigot and say, well, now you really should just go see your doctor. I think people are learning that telehealth is just as valuable as having a face-to-face with your physicians. And so I hope that we're going to continue that. I think I know here in South Carolina that we've accelerated and loosened a lot of the restraints on telehealth. I don't see us going backwards in that. I don't really see CMS going backwards. And then it's going to be incumbent upon us to make sure that the private providers don't do that either. And I think that they're going to realize that it's a more economical way to provide health care to people than having a face-to-face on most of the visits that we need as preventive or routine checkups.
I agree with that, and I think I'd like to take a second just to thank our payers for stepping up to the plate, because I think they really made it possible, particularly for rural providers, to be able to do telehealth. So, in a lot of the things you just mentioned, remote commuting to work, people are not having to go into the office. They can't go into the office. The schools have gone to virtual learning. Telehealth has exploded. One thing that has brought to light is the lack of broadband in rural areas, or maybe even the lack of affordability of broadband in rural areas. And your thoughts on that, and kind of where do you see the state of South Carolina? What is their role in this whole problem that we're having?
Well, like I mentioned earlier, having some good come out of bad, and obviously we talked about telehealth, and that's one of the shining aspects of what we've done in this new normal that we're living in right now. But also the attention to broadband. There's been a lot of us who've been real concerned about broadband, and it's from those of us in rural areas. I live in Sumter County, and within the city limits, we got great broadband. We've got providers that have put fiber optic cables and broadband under our streets, and all of us who live in the city have plenty of broadband. But you go 10 miles out in Sumter County and there's no broadband, and again, it's just like healthcare. And you've heard me argue this all the time. It shouldn't matter what zip code you live in as to the healthcare you get, and it shouldn't matter what type of broadband access you have, because internet is a way of life for all of us now, and you have to have it in order to now receive education, health care, to have a quality of life. And so out of that, good things happen. At first, it got on the radar at the federal level, and I think that is very good. And the way it benefited us in South Carolina, as you know, they passed the CARES Act funding in the late spring, and so what we did was they made broadband an accessible expenditure under the CARES Act. We got $1.9 billion in South Carolina, and that was a lot of money coming into South Carolina, and we had to spend it by December 31st. And so we made a commitment of $50 million of that to broadband infrastructure, and went with and basically put Office of Regulatory Staff in charge of that. ORS is what we call it, and ORS brought the stakeholders together and did some great things. And the first and foremost was mapping. We need to figure out where our deserts of broadband are in this state. We can all guess, but we need some quantifiable data as to where that is. And so they've embarked on the mapping. They deployed broadband, obviously for schools was our first emphasis, and give citizens in those areas hotspots and make sure they do that, but then also start the deployment. So that was the first step we had, was with the CARES Act fund and the ORS. And I cannot thank them enough for what they have done in that regard. And they still have a group of stakeholders that they're working with to come and have recommendations for the General Assembly when we get back. Then the last day of session last week or 2 weeks ago was we passed a new broadband bill in which the stakeholders got together, and it has a long way to go, because funding is going to be a key component of it, and funding is something that's very important to a lot of us in the General Assembly, but also very important to, I hear the Congress talking about it, and I expect some money to be coming down from Congress to us probably by early next year. But one thing we did was work with the stakeholders and the electric co-ops and the telephone cooperatives, and allowed access to poles and access to their resources. And also, as we know, the rural telephone cooperatives or rural electric cooperatives were created to bring those services to rural South Carolina. So why not partner with them and let them bring the services to broadband services to rural South Carolina. So we forged an agreement. It wasn't easy. It took a long time for that to happen, but that is now in the works. We passed the bill and it was signed by the governor. So now it's going to be easier to utilize infrastructure already there by the co-ops and Santee Cooper and use their infrastructure to help bring broadband to the area. So I think we made great strides in this pandemic. It's just, again, it's a start. It's not a finish. And we all need to make sure that the ultimate goal is no matter where you live in South Carolina, you have access to broadband.
I couldn't agree with you more. And so that's another positive that has come out of COVID-19 is the passing of this legislation. So hopefully we can expand broadband to every area of South Carolina, regardless of exactly what you said, regardless of what your zip code is.
That's correct. Now I look forward to continuing this work we've done, and we made a great start. But again, we can't lose sight of the importance of this when this pandemic ends.
Representative Gilda Cobb-Hunter, we appreciate your time this morning. And we're going to ask you just a few questions about broadband and telehealth. As I understand it, you were one of the co-sponsors for the GREAT bill. Could you tell us just a little bit about that bill and how it will impact South Carolinians?
Sure, I was pleased to be one of the co-sponsors for that bill. Very much concerned about the lack of access across South Carolina as far as broadband is concerned. And we see that bill as the first step in a long process of making sure that every home in South Carolina is covered, or I should say every home that desires or wishes to have access to broadband is covered. It is really revolutionary for us here in South Carolina and a very important, as I said, first step to making sure that homes are covered. I like the creative partnerships that are allowable under this legislation. And quite frankly, all of us, regardless of which side of the aisle you're on, recognize the importance of broadband. The pandemic has really driven that point home, whether we're talking about online schooling or telehealth, telemedicine. If there is no internet access, none of that can happen effectively. And all of us want our citizens in South Carolina to be able to access broadband for a variety of reasons, school and health being two of the main ones.
I couldn't agree with you more. I think we are a leader in the nation, and I think we've done a great job with telehealth. And again, it would not be possible without the support of the General Assembly. One thing that I'd like for you to comment on is I think the payers did a really good job when COVID hit of loosening the restrictions for reimbursement, not only CMS, but our own Medicaid and our private payers. And we're hoping that once the pandemic ends, that those loosened regulations will, will continue to be in place so that we can continue to move telehealth forward. Any thoughts about that with the payers and the reimbursement?
Well, of course, all of us recognize that our timeliness, shall we say, in reimbursing vendors and providers is not as swift as it should be. The pandemic has taught us a lot of things, and this whole notion of the regulatory process is one that is coming under review. As far as provider payments, I don't think there would be any argument from anyone in the legislature that any improvement in getting vendors payments in a more timely manner is something that we all should strive for. Of course, the caveat for me is making sure that in our loosening of regulations, that we aren't losing any kind of transparency and accountability for taxpayers' dollars. I don't think that that's an issue. And so I would certainly be supportive of those, shall we say, easing of the burdens of reporting and reimbursements. I certainly would be supportive. of making some of those changes permanent, because at the end of the day, what we want as a legislature are providers who are well compensated and compensated in a timely manner. So we're working on the timely manner piece of it. The well compensation, I know, is a matter of perspective, and so perhaps we can do a little bit better at some point as far as the rates of reimbursement.
I agree with that. And so do you think that the future of telehealth is here to stay? That we will continue to see this in our future?
Oh, without question, without question. And one of the things I would suggest to you and your colleagues on the provider side of the scale is that you, if you've not already advocated, and a part of what you're doing here is, of course, advocacy for your position. But I'm just a firm believer that the squeaky wheel gets the grease. And so my point is somebody in your network and in you and your colleagues should be making a lot of noise with legislators about how great it's been to receive your payments in a timely manner. And wouldn't it be nice, General Assembly, if y'all would think about making that permanent? Because a lot of times people assume we know things and we really don't. Sometimes when it's brought to our attention, we take steps to make corrections. And I think this would be one of those times, but I certainly know that my chairman, Merle Smith, has an answer for you on that. And you can take it to the bank, because I know he is supportive as well of timely reimbursements.
Yes, ma'am. I had the pleasure of interviewing him prior to this. And of course, he's always been a big advocate for telehealth.
Oh, yes.
So we will heed your advice, and we will make sure that we advocate for that. And I will tell you that during COVID, one of the things that I learned was how patients and consumers came out, and they wanted to know, this has been great for us. We are comfortable during the pandemic of seeing our provider from home. And what can we do to make sure that this stays and we can continue to do telehealth? So any word of advice from us as a patient or a consumer perspective?
Sure. As patients / consumers, if you've enjoyed being able to commute with your doctor or have conversations, communications with your physicians, then you should reach out to your legislator and let him or her know, wow, I really am enjoying this telehealth piece. You guys did a great thing when y'all started it several years ago. We need to keep this up, and y'all need to expand this so that it is truly comprehensive from a telehealth perspective, because it's not as comprehensive as the potential for it to be. So I've said all that to say your patients, your consumers should be reaching out to their members of the South Carolina Senate and letting that representative or that senator know how much telehealth has been good for you during this pandemic, how it has loaned itself or lended itself, whichever is appropriate, to this notion of safety and security, accessing services in a safe and secure manner, because that's what telehealth has been able to do as a result of the pandemic.
Well, some more great advice that hopefully when folks listen in on this session, they will again listen to your advice and reach out and advocate for that. So I have one more question for you around broadband. The CARES funding that was given to the Office of Regulatory Staff, which, by the way, I think they've done a phenomenal job getting the hot spots out and making sure that our kids can actually do virtual learning from home. Do you think there's going to be an opportunity after 2020, once we start into the new year, of the legislature coming together and creating a broadband office that will be here to stay, that we can continue with these works or efforts, or do you have any vision of how that will go forward?
I hadn't thought about this notion of creating an office. I'm not much for growing government, believe it or not. I am very much invested in expanding broadband. I really believe that that is something that can be done through our current structure, through the Public Service Commission, through the Office of Regulatory Staff. It may be, however, wise for us to look within that structure and create a specialty, if you will, under ORS dealing just with broadband. I'd be very hesitant about creating a new piece of government whose sole responsibility was just broadband. I think our existing structure could very much accommodate a single focus of broadband without adding and growing government.
Well, I think that's a great perspective. And again, we believe that ORS has done a phenomenal job. We've been working closely with them and the Department of Education, and it was really nice to see everybody come together and actually collaborate to try to solve such a huge issue that we've had. So we appreciate your time. Any other comments on the future of telehealth or broadband that you'd like to say to your constituents and the viewers for the summit?
No, we'll just pick up on the final point you made, and that is how this, I see it as a crisis, using the Chinese version or adage rather, turning a crisis into an opportunity. This has really provided this country, this state, this community with an opportunity to identify strengths and weaknesses and talk about how we can improve upon them. More importantly, the one thing that I've discovered as a result of this has been people working together, people getting out of their silos, not so much issue of turf and all of that we sometimes get bogged down in. It's been good to see people who recognize that we're all in this together and we've all got to figure out how we do this and make something better as a result of it. And I just really, again, would just like to commend Palmetto Care Connections for the work that you all have done, the work that you are doing and will do. And as you celebrate your 10 years of service to this community, I wish you all the best. Congratulations again, and I hope you will have 10, 20, 30, 40, countless number of years celebrating the work that you do. Thanks so much for having me.
So we would like to welcome Senator Tim Scott to our 2020 South Carolina Virtual Telehealth Summit. The first question I'd like to ask you revolves around telehealth. We'd like to thank you for co-sponsoring last year's Connect for Health Act, as some of its provisions were included in one or more of the stimulus bills that were passed earlier this year. And we'd also like to thank you for encouraging Congress to expand access to telehealth services on a more permanent basis, and for encouraging the federal government to collect and analyze data around telehealth during COVID-19. Could you respond a little bit to that and maybe where you think telehealth is going for South Carolina and for the rest of the country?
Yes, ma'am. First, let me just say thank you for that. Without any question, recognizing the value of connectivity or the value of connection is undeniable, especially if you've ever been in a situation where you needed a connection and couldn't find one. Imagine the people who live that way every single day. There are some dead spots. If you're on the phone and you're driving down the road and you missed a call, you're like frustrated. But imagine if you're in a situation where at your home, you don't have the ability to connect to listen to your doctor or to have your doctor's visit happen because you simply are in a dead zone. And that is crippling some people's ability to respond to this great pandemic. So it was my great pleasure to participate in the CARES Act and other programs that even stated before the CARES Act, focusing on issues of connection. I think solving that issue is one of the fastest ways to accelerate improving the quality of health outcomes for South Carolinians in our rural markets, as well as around the country. It's one of the reasons why we dedicated somewhere around $16 billion for states that they could use on behalf of those citizens that desperately needed more connections. And as you are so intimately aware of, in South Carolina, so many of our seniors, somewhere, my statistics may be off a little bit, but around 700,000 seniors today do not have the type of access, broadband connections that they need. that is a real problem, especially, and this may be the longest answer in the history of America, but especially when you take into consideration the fact that because of the pandemic, we saw utilization of telehealth and your primary physician appointments go from 0.1% in February to 40% in April. If you don't have that connection, you are missing out on the ability to keep yourself safe at home and not expose yourself to the virus. This is something that we should all take very seriously and to work aggressively towards solutions for those folks who are most vulnerable.
I totally agree with you. And I think the elderly population has been particularly vulnerable during COVID-19. And we have been surprised to see the number of elderly folks that have done a telehealth visit that have been satisfied with it and that would do it again. We just need to make sure that the reimbursement is going to remain in place. Do you have a good feeling about continued reimbursement for telehealth?
We're going to have to fight for it, to be honest with you. There's no doubt that having a connection gives you access. Having reimbursement gives you resources. So
Right.
You can't have one without the other if you want to bridge the gap. And so one of the pushes that I am a part of was, and I hope that we will do it in a bipartisan fashion. Sometimes we look at Congress and you just, as the young people say it, SMH, shake my head. So literally, this is a bipartisan issue where a lot of senators are all working to solve the problem of connection and solve the problem of reimbursement at the same time. That should be really good news for our rural seniors who for decades now have been struggling with getting to the doctor's appointment, having a specialist. I mean, if I've heard it once, I've heard it literally 1,000 times, that the issue of connectivity is a big problem, but more importantly, finding the right specialist in your neck of the woods is harder because the doctors have been going away in many ways, and the specialists have not been ever present in every rural community throughout South Carolina. So having a connection gets you a specialist that might not live next door. And that's a beautiful thing. So I want that to happen for more of our seniors around the state.
Well, you have stepped up and become a champion for broadband before the pandemic, but particularly during the pandemic. And I think one of the bills that you have sponsored is the Connecting Minority Communities Act, which I think is a really good act. Could you speak to that just a moment?
Yes, ma'am. Thanks to partners on the broadband charge, folks like Senator Roger Wicker, Senator Lindsey Graham, Democrat Senator Schatz from Hawaii. We've had a really good coalition of people working really hard on issues of connectivity. But what we found is our rural population and our minority populations both suffer from the same challenge of connection. And when we solve that problem, we actually improve outcomes. And not in this conversation, but overall, the need for telehealth is undeniable, but also teleeducation, telework. So the broadband issue impacts the quality of your health, not just from a healthcare perspective, but if you're able to work and your kids are able to go to school, that helps your overall well-being. And so for minorities in our rural population, we have to bridge the gap. And thankfully, I've partnered with friends in the Senate that has the same heart for the issue. So we have a lot of resources focusing on bridging that gap, as well as using our HBCUs in states like Mississippi, from Roger Wicker's turf, so to speak, to Lindsay and mine here at home in South Carolina, where we're able to use the 8 HBCUs, historically Black colleges and universities, as hotspots. And we also have been working with minority serving institutions to be hotspots as well. And what that translates to is, instead of having to find your local Starbucks or going to your Krispy Kreme donut, that's not a bad place to visit every once in a while, but not daily. So
that's right.
You can go to your HBCU or you can go to a minority serving institution and find a hotspot so that you can have the connection if you don't have it at your home. Of course, long term, our goal is to get it to every house in every state throughout the nation. But until we get there, we're looking for hubs in communities where people can get there.
And so I'll agree. One of the things that the pandemic brought out, as you so clearly stated, is the lack of broadband, which is not just a state issue, but a nationwide issue. And it's not just for rural areas, but for some underserved areas and some urban communities. And I think empowering the states to get more involved and sort of step up to the plate. I think you and Senator Graham also proposed the Governor's Broadband Development Fund.
Yes.
Could you speak to that just for a moment?
Sure. So one of the things that we're excited about, and we've seen this happen through the CARES Act, and our governors have used resources in many ways to be very helpful, and Governor McMaster has done that certainly here at home. One of the things that we've done through that act, as well as other initiatives, is to try to identify the resources, send them to the state, so that in one case, the governor is able to access $50 million in federal dollars to connect households to broadband. And we're going to continue to do that. We have some other initiatives that go beyond the bill that we're talking about now that will help with the FCC, USDA, all targeting the broadband issue. I figure if you can find, instead of one arrow in the quiver, if you can have 4 or 5, just keep shooting until you hit the target. Even if they spin you around, when you're no longer dizzy, you have another shot. And for our seniors, they're dizzy sometimes because they're just doing the best they can with limited resources. And someone has to stop the moving and hit the target. And when you have a $50 million resource, it hits the target. When you have the $16 billion in the CARES Act, it helps you hit the target. When you're able to access another piece of legislation that would target about $20 billion, you get to hit the target. So if we have all the arrows in the quiver shooting at the same target, the chances go up exponentially that we're going to help some of our most vulnerable individuals who are, for a significant reason, concerned about entering a hospital, healthcare facility, going to their doctor's office. If we can help them stay at home and get the same quality of health, as you said earlier, seniors surprisingly are finding telehealth to be an attractive option. That's really good news for longevity in our state. And so we've worked on a number of bills to include the ones that we've talked about so far, and a few others that would really provide traction under the umbrella of connection and broadband issues.
Well, please know that you have local grassroots advocacy efforts going on to support all of those broadband issues. And it sounds like you are in agreement with us that telehealth is here to stay. It's going to be a part of our future. And if we can solve this broadband issue, then we can make healthcare more available to people in need.
100% agree with you. And it is going to be a bit of a tug of war over the next few years. But one of the things that we can't have happen, in my opinion, one of the things I will hopefully be able to slow down is to go back to February, where 0.1% of folks were able to have telehealth as an option because of either connection issues or, as you brought up so clearly, reimbursement issues. Both are critical so that there's not a cliff. I hate to see the cars, I was watching a movie one day where the car got right to the cliff and stopped just in the nick of time. Well, in movies, those good, happy endings always happen. For seniors without connection, it's a little more daunting of a task. So I look forward to hopefully extending the runway or extending the cliff so we have more and more folks staying on the right side of that cliff.
So Congressman Jim Clyburn, thank you so much for joining us for the 2020 Virtual Telehealth Summit for South Carolina. We greatly appreciate your time. We know that you're really busy. So the first question I want to ask you is, more than a year ago, you formed the House Rural Broadband Task Force with the goal of bringing affordable, high-speed internet to 100% of Americans. Together with members of that task force and the House Democrats, in June, you introduced an act called the Accessible, Affordable Internet for All Act. Could you tell us a little bit about that act and what that means for Americans?
Well, thank you very much for allowing me to participate. I am instructed in all that I do by history. I always say that history ought to be our teacher in all the things that we do. And when I look at what rural electrification did for this country, it brought rural communities into the mainstream of economic opportunities back in the 20th century. And I'm instructed in all of this by the testimony I often talk about of the farmer who stood up in a rural Tennessee church one night and says, brothers and sisters, let me tell you something. The greatest thing on earth is to have the love of God in your heart. But the next greatest thing is to have electricity in your house. Now, I believe strongly that was the next greatest thing for the 20th century. But for the 21st century, the next greatest thing is to have broadband in every home. We are not going to be able to efficiently and effectively deliver health care throughout America without telehealth, without telemedicine. And we know today many rural communities are having to have telehealth and telemedicine effectuated by the telephones because people are not connected by the internet. And so we ought to go about the internet the same way we went about the telephone and the same way we went about electricity. And so I'm so pleased that the South Carolina legislature has come to grips with the fact that rural electrification, what was done, allowing the co-ops to use their right-of-way to do for the internet what we did for electricity.
Well, I couldn't agree with you more. And I think during COVID-19, for example, in Bamberg County, 70% of our kids in our rural school district did not have access to the internet. So what specifically will the Accessible, Affordable Internet for All Act, how does that work and how will that expand broadband?
Well, the problem is it's going to be out over a period of time. It's a $100 billion program. And it will, as you know, probably string out over 10 years. However, there's so much we can do in the interim as well. We can create hotspots in areas where there's nothing going on now. So what my hope is that the long-term program will get put in place and we will do what we can with hotspots and other mechanisms until we can get to the end result. I am a great believer that the journey of 1,000 miles begin with a single step. But no matter how long the journey, if you don't take the first step, you're never going to get there. So it may not be everything at once, but we got to start on this journey now, because the longer we put it off, the worse off these rural communities are going to be. Our children growing up in rural America must be connected to the rest of the world. As you said, in Bamberg County, 70% of the kids are without, the internet. That means in the world of this pandemic, they're not going to be connected to education at all, because online learning cannot take place in their homes. Rural hospitals are closing. Bamberg Hospital was one of them. 4 rural hospitals are closing in South Carolina because if you had the internet, and these hospitals could be connected to teaching hospitals, like if the Bamberg Hospital and the Bondwell Hospital, like in Hampton now, Fairfield, these hospitals, if they were connected to MUSC or the University of South Carolina or the teaching facilities over in Florence or up in Greenville, I think these hospitals will still be open.
I agree. I couldn't agree with you more, and you bring something home that's close to my heart because we were at the Bamberg Hospital for a long time. As far as expanding access to the internet goes, we also know that it's not just an access issue, but it's an affordability issue. And for a lot of our low-income households, we're going to have to work with a lot of our service providers to make sure they have affordable packages. Any thoughts on that?
Yes, yes. As you know, my mantra for living, I've had billboards all over South Carolina saying what my goal is in my service in Congress. I believe very strongly that this is a great country. Our problem is that that greatness is not accessible and affordable for all. And that, to me, is what has to take place. If it's health care, it's got to be accessible and affordable. Housing, accessible and affordable. Education, accessible and affordable. Those are the watchwords. So whatever we do, and if you look in the legislation that I put forward, it's not just there to make it accessible, but we also put the funds there necessary to supplement people who need the funds to make it affordable. So to me, just having access is not enough. Under current FCC rules, as you know, they say if one house in a census tract is covered, then that whole census tract is deemed to be covered. Not so. If you look at the history of South Carolina, the big house that's there because of the former plantation that existed, they have the internet. But all those houses that grew up around there in that same census tract, they don't. So you cannot say if one house it has the internet, the entire census tract is covered. That, to me, should not be, and we address that in this legislation as well.
That's good. But another question is the maps that we contracted in South Carolina for. I think you shared that with your task force, and our thought was that you've got to know where those homes are. So any thought on the broadband mapping piece?
Absolutely, and you guys ought to be proud of what you've done. I invited you up to Washington to sit down with my rural broadband task force because I wanted to show off to you guys that there are great things happening in many areas in South Carolina. And I just want you to know that those people took your efforts back to their states. I'm talking about Vermont, I'm talking about Iowa, I'm talking about upstate New York. You all really made a big, big hit in South Carolina because of what we've done here. And it shows you what can grow from innovation. Because if you go all the way back to Ernest F. Holland's administration, when the ETV became a big thing in South Carolina, what you all have done is taken advantage of that. Because what we did to build out educational TV throughout South Carolina, which became a model for the rest of the country, you're now using those towers to make South Carolina a model for the internet. So your mapping here in South Carolina is something that you should be proud of. I hope you are, because I sure am proud of it.
Well, thank you for those kind words. We really are, and the fact that you think they're good roadmaps, and the fact that you shared them with other states, we really appreciate that. So
Thank you.
I have one more question for you around telehealth, and the Coronavirus Aid, Relief, and Economic Security Act, or as we better know it, the CARES Act, provided funding and continues to fund to protect the American people from the public health and economic impacts of the COVID-19 pandemic. What are your thoughts about expanding telehealth services with the CARES Act funding, and what do you see as the future of telehealth in South Carolina and in our country?
Well, you know, the CARES Act is good, but not as good as it could be. And that's why we passed the HEROES Act. The HEROES Act, we now have two versions. The first one, $3.3 trillion. The second one, $2.2 trillion. Now, we didn't change anything with that second act. What we did was cut back on the timing. See, rather than a program being built out for 18 months, we brought it back to 12. Some that were 12 months, we brought it back to 6 to reduce the cost. But I'm hopeful that we will get to the point where we will take the HEROES Act as the next step. The CARES Act, good work, very productive in many instances, not as productive in some as it could be. We want the HEROES Act is much more comprehensive, and it deals with state and local governments the way the CARES Act didn't. Because in many instances, in order to get the broadband that we need, we got to involve state and local governments as well, because so many of them rest on the success of what happens with, let's just say it, co-ops and how they exist in these communities. For instance, the Rural Energy Savings Program, that's an energy program that's in the co-ops. That program will have a tremendous impact on rural health as well, because we want not just residents. And what we did in the second version of the bill, we brought businesses into it as well, so that businesses can afford the energy programs that they could not afford before.
Well, again, we're in total agreement. Do you think that telehealth is here to stay?
Absolutely. I don't like to get personal about these things, but I do sometimes. As you know, my wife, a year ago, last month, lost her battle with diabetes. And it was my experiences with her and her caregivers. When I sat down with her doctor here in Columbia and watched him diagnose the ailments of a patient down in Sheldon, South Carolina, Beaufort County, over 100 miles away, it convinced me that telehealth is the wave of the future. We are not going to have the effective delivery of healthcare without telehealth or telemedicine, whatever you may wish to call it. Yes, it's here to stay, and it's going to be improved upon.